Chemical substances that alter a person's physical, emotional, or behavioral characteristics are classified as drugs. Any drug might be damaging if used excessively. Some drugs can also be harmful if taken in dangerous combinations or by hypersensitive persons in ordinary or even small amounts. Numerous harmful chemicals are present in substances like glue, paint, thinner, gasoline, and other volatile or breathable solvents. They should be utilized and distributed responsibly. In 2019, it was estimated that 1.7 million Filipinos used harmful drugs. Only 5,277 admissions in inpatient and outpatient facilities were documented in the same year, excluding individuals who used community-based programs to receive care. Any use of a chemical substance, whether legal or illegal, that affects a person's physical, mental, or social functioning is referred to as drug abuse. Any of the following practices are considered as drug abuse. You are using valuable drugs without benefit for prescription that can change the mood or behavior. You are using drugs and chemicals for purposes other than those they were intended. You are utilizing drugs and substances that have no legitimate medical application for purposes other than research.
Why do people turn to drugs? There are many different reasons as to why people turn to drugs, either for medical purposes or personal entertainment. Here are some of the reasons. Firstly, medicines apparently help in solving life problems. Second, drugs are widespread and therefore easily accessible. Third, pressure received from fellow peers and the environment. In some cases, people turn to drugs due to the people around them and their conditions in life. Last, the belief that drugs can also be used as an alcohol substitute, both giving temporary happiness and enjoyment to the abused user.
Although some drugs treat one's health problems, drug abuse can lead to further complications. Drugs that are commonly abused depending on their pharmacological effects may be classified into stimulants, hallucinogens, sedatives, and narcotics. First, the stimulants, which are a type of drug that speeds up the transmission of messages between the brain and the body. They have the ability to make a person feel more awake, alert, confident, or energetic. Illegal stimulants are typically smoked, snorted, or injected, while prescribed stimulants are typically taken orally. Examples are amphetamine, cocaine, caffeine, and nicotine. Next are LSD, mescaline, and marijuana, which are types of the hallucinogens, which are a diverse group of drugs that alter a person's awareness, own thoughts, and feelings. Changes in time and space perception, delusions, and hallucinations may be mild or overwhelming depending on the dose and the quality of the drug. Third, sedatives, which are usually in the form of a pill or a liquid. Abuse of sedatives can result in dependence and addiction, while some treat varying conditions such as anxiety, tension, seizures, and sleep disorders. Remember that two sedating substances should not be mixed since fatal suppression of breathing can occur. Lastly, the narcotics, which are also known as opioids, which are only used for pain that is severe and is not helped by other types of painkillers. They work by binding to receptors in the brain, which blocks the feeling of pain. Some examples of these are opium and its derivatives such as morphine, codeine, and heroin.
And now, let us talk about on how you can tell when one is abusing drugs. You will immediately know a person who is abusing drugs has a lot of changes in behavior, appearance, and mood. The changes may be pleasant or unpleasant because drug addiction does not occur suddenly. It usually begins by abusing small amount and over time progress into dependency. Some of the most telling signs of chronic drug use are physical changes to the body, both externally and internally. Here are some tips on how you will know if a person is using or abusing drugs. The first sign is irritable, discourteous, defiant, and aggressive. Second, untrustworthy and lacks of self-confidence. Third, unhealthy and unconcerned with good grooming. Fourth, has a low frustration tolerance. Fifth, lacks interest with his studies or work. Sixth, blames everybody for his problem. And last, prefer his barkada where he feels accepted. Though there are more difficulties to determine, internal changes such as unexpected heart and kidney problems can also be signs of chronic drug abuse. Allow me to share this based on true experience of mine. When I was 16, I knew someone close to my heart that was abusing drugs since she was college before she became a mother. Before then, she was a very healthy person, a dreamer, and a loving person to her grandchild and children. But days fade away and everything changes. Every daylight, she is sleeping, eating a lot, or sometimes not eating for how many days. And every night, she's alive. She's going out and will go home with a different aura. She's shouting non-stop, hallucinating, blaming other people, having mood swings. Her eyes are often red, bloodshot, or glassy. Her appearance suddenly drops and she loses weight. And she always prefers to go out with her friends rather than her own family. She is different from before and now. And we came to the conclusion that we can't control her anymore. So we decided to send her to a drug treatment and rehabilitation center. There, the doctor explained her condition to us, and she was really abusing drugs, and you can really see it through her physical looks and behavior. Abusing drugs can really destroy not just your personality, looks, and behavior, but it can also destroy the relationship between your family and your friends. Always remember that before trying or doing anything illegal things, you must think of it 10 times and must know the outcome of your action. Think before you take.
And next, what are the ill effects of drug abuse? Drug abuse leads to medical and health problems. The physical complications depend to the extent of specific drug, its source, and the way it's used. Here's the physical and mental complications. First, malnutrition. The lives of drug dependents revolves around drug abuse. They miss their regular meals because they lose their appetite. Next, panic reaction. The loss of thought process can cause panic reaction or feeling of invulnerability. Both of these states can lead to injury or death. Lastly, physical damage. In addition to those diseases, which accompany the use of sterilized syringe and contaminated drugs, these may cause certain medical problems, like kidney failure, hepatitis, drastic weight loss, and vitamin deficiency are some of the adverse physical complications. All drug usage has a bad influence on one's health. Sleeping disturbance and reduced memory are common side effects of drug addiction. A person who takes drugs may not recognize that they have a problem until they noticeable side effects, which may take months or even a year.
What can a person do to prevent drug abuse? Understand. Learn to understand yourself, needs, wants, and limitations. Explore. Explore and develop positive potentials you did and can do. Know. Know who is the right person to trust and communicate with, especially with sensitive and personal things you have going on. You must also know and respect the boundaries that person set. Maintain. Maintain and take care of one's own physical and mental health. Develop. Develop strong moral and spiritual foundation. Use. Use drugs when recommended by professionals and appropriate dosages only. Look. Look for healthy and positive ways of coping without the use of anything that can harm you and the people around you. Seek. Seek for professional help if you feel like you can't cope in a healthy manner.
The first drug that we will discuss is ecstasy. Ecstasy is a synthetic amphetamine-related substance. It is commonly known as a party drug because it is a stimulant many young people take recreationally. An individual takes the drug through oral ingestion, however, some alternative is through inhaling for a faster effect, but this is usually painful and irritating to the nostrils. It is seriously risky when combined with alcohol or consumed by those who have heart disease, diabetes, asthma, or psychosis. When it comes to psychological effects, it is classified into two categories. For positive effects, a person will feel euphoric, increase in energy and socialization, feeling of love and empathy, increased awareness of senses, neurotically based fear dissolution, and experience of bright and intense sensations. The second category has negative effects, which include inappropriate emotional bonding, tendency to say unusual or uncomfortable things, depression and fatigue up to 7 days, confusion, drug craving, severe anxiety, and paranoia. There are also short and long-term effects of ecstasy that can affect a person more. The short-term includes restlessness, anxiety, pronounced visual and auditory hallucinations at a larger dose, increased blood pressure and heart rate, which may lead to cardiac arrest, nausea, and vomiting, while long-term effects are psychosis, irregular heartbeat, same effects as with amphetamines, psychological dependence, and depression.
Marijuana. Cannabis is a green or gray mixture of dried, shredded flowers and leaves of the hemp plant. This mixture is commonly known as marijuana, and it affects the areas in the brain responsible for movement and memory. Marijuana in its smoked form has no commonly accepted medical use. However, the active chemical in marijuana is manufactured into a pill available by prescription. This prescription drug is used to treat the nausea and vomiting that occur with certain cancer treatments, and it also aids patients eat more to keep up their weight. The high. Marijuana alters chemicals in the pleasure circuit of the brain. It can cause a calm euphoria as well as fits of laughter. The low. Marijuana can trigger a number of negative effects. After an extended period of marijuana use, a user may experience withdrawal, depression, fatigue, and lack of motivation. The user's grooming habits may become careless, and relationship with family members and friends may become hostile and begin to deteriorate.
Sa may pinakalingaw na parte si mong kinabuhi karon para sa adlaw.
The first video was an example of inhalants, and inhaled substances are chemicals found in certain household and workplace products that produce chemical vapors. These are rapidly absorbed into the brain to produce a quick high. It is dangerous also because it will cause permanent damage to the brain or may result in sudden sniffing death. In addition, abusers under the influence of inhalants are prone to accidents and can also become violent due to the psychological dependence that the inhalants produce. However, to maintain producing the same effect that the user wants, he should increase the dose gradually. Next, here are the immediate effects of inhalants, such as confusion or disorientation, distorted perception of time and distance, aggressive behavior or violence, illusions, nausea, vomiting, and hallucinations. On the other hand, the delayed effects are loss of memory, inability to think, muscle cramps and weakness, numbness in limbs, abdominal pains, and damage to central nervous system, kidneys, and liver. To help you understand and provide more information about inhalants, here's a video by Moy Moy Palaboy that includes a song about rugby boys, as well as some facts about rugby boys that I indicated that will be presented in the next slide.
I'm a rugby boy, natambay sa circle, singot sa plastic, is it fantastic? We will always share, almost everywhere, imagination, weird hallucination.
And next, cocaine. Cocaine is a drug extracted from the leaves of coca. Cocaine is harmful because even a little amount of cocaine can create physiological difficulties. Preparing freeways expose the users to risk of death or serious injury from the fire or explosion. Users also get addicted to the substance and devote their entire lives to obtaining and utilizing it. Cocaine is available in the following forms. First, cocaine hydrochloride is a form of most available form, and it is a fine white crystal-like powder that is medically known as a local anesthetic. Users sniff or snort into the nose. Second, street cocaine hydrochloride or rocks. These are the larger piece of cocaine hydrochloride. Third, freebase is a purified substance of rock and it is usually injected or smoked. Lastly, cocoa paste is a crude product smoked in South America. It is more dangerous because it has contaminants such as kerosene. And next, the immediate effects of cocaine are dilated pupils, increase of blood pressure, heart rate, breathing rate, and body temperature, sense of well-being, feels energetic or alert, less hungry, and lastly, the slurred speech. And here's the delayed effects of cocaine. These are the psychosis, restlessness, anxiety, sleeplessness, snuffy or runny nose, confusion, and slurred speech.
Next, let us talk about opiates, or sometimes called narcotics. It is a group of drugs that are used to relieve pain but have a high potential for abuse. Some opiates come from a resin taken from the seed pod of the Asian poppy. Here are the 5 types of opiate drugs. First is opium. It is a dark brown chunks or powder that are usually smoked or eaten. Second is morphine. It is a white or brownish powder that is usually dissolved in water and then injected. Third, we have heroin. It is diluted or cut with other substances such as sugar or quinine. Fourth, we have codeine. It is an opiate or prodrug of morphine mainly used to treat pain, coughing, and diarrhea. Last is synthesized or manufactured opiates. Comes in capsules, tablets, syrups, solutions, and suppositories. Opiate-dependent women may give birth to babies with defect or who are dead. Morphine, meperidine, paregoric, which contains opium, and cough syrups are the most common opiates with legal medicines uses that are abused. The immediate effects are restlessness, nausea, and vomiting. The delayed effects are uneasiness, diarrhea, abdominal cramps, chills, sweating, nausea, runny nose, and eyes. Next is symptoms. Symptoms begin for 4 to 6 hours after the last dose of the drugs, are stronger for 24 to 27 hours after, and subside within 7 to 10 days. Sometimes symptoms such as sleeplessness and drug craving can last for months. The treatment for opiate addicts are detoxification in a hospital or as an outpatient, rehabilitation in therapeutic communities, outpatient drug-free programs, methadone maintenance using methadone, a substitute for heroin on a daily basis to help people lead productive lives while in treatment.
Wag. Wag.
Wag.
Wag. Wag.
Wag.